Thank you for watching the Whittemore Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner. Thank you for watching the Whittemore Community Magazine live on Facebook. You can watch a rebroadcast of this episode by visiting WCM Live on YouTube.
Hey, good evening. We're having difficulties there, I believe. Anyway, we want to welcome everybody to our program this evening. It is a very critical program, this particular topic, and as the promotion has shown, it's going to be about cancer, but we want to put, a heavy focus on prostate cancer for Black men, okay? So I'm your host, Ed McQueen. I will co-host April will not be with us this evening. She'll be back next week, but I know she's listening. So I want to welcome everybody to the show, and let's begin by saying that the issue of I'm going to start with prostate cancer, of all the cancers. Issue of prostate cancer is a very critical one, and it's something that most Black men don't like to talk about. You know, all men have the issue of Black men in particular. And throughout this program today, I want to put emphasis on that. And I've got some couple of more additional information, other than what our guest is going to be talking about. And our guest, as the promotion stated, it's one of our fraternities, the Omegas, who had grabbed this issue by the hand and got a hold of some resources, the monetary resources, to deal with their concerns, what they're concerned about the community and the different cancers in the community. I think one of the focus was on prostate, but they can correct me if they want to in there. So, having said that, let's go to our guest. We have Mr. Elazer Barnette. He is the director. Excuse me if I'm not pronouncing your name correctly, but you can correct me at any time. I think Barnette, he's the director of the NEP program.
That's great.
When we come back, after introducing everybody, I'll let the director explain to you what the NEP program is. And next we have Brother Aaron Butler. My understanding his title is he's the screening coordinator of this project. Okay. And Mr. Randall Coleman, also a screening coordinator. And we have someone who's going to support us on all this information about especially prostate cancer. Dr. Winston McIver Jr. And I want to welcome all of you today, and welcome all of our live audiences. You can get us through wcmagazine.net, okay? www.wcmagazine.net if you want to listen to us live or on Facebook. Okay, we're going to start with Dr. Elazer Barnette. We're going to ask if you could give us some introduction. Okay. What this project is and what it means to the community, and how you all got the grant, okay? If you would.
Okay. Good evening to Queen, and also for the community for giving us an opportunity to come to you tonight to talk to you about a very important issue, and that's three major cancers that's impacting African American men, and that's colorectal, lung, and prostate cancer. I'm thankful that the Omega Psi Phi fraternity, Omega Men of Orange County, received the grant back from the Carolina Cancer Alliance to help us focus on this challenging problem that's happening among African American men. So we're truly glad that you're hosting us tonight and also to engage in this opportunity so that we can help reduce some of the disparities that's occurring among African American men with these cancer events and so forth. So the project is, as you see, the acronym APP, and basically they focus on North. But the focus is that we want to look at stage intervention that can reduce the disparities among cancer disparities among African American men. That's really what it's all about. The project is going to come at you in 3 phases, and Ms. McQueen and others, what we want to say, we started off thinking that we could do these kind of in a group session traditionally, but COVID has changed a lot of that. So everything about the project now is online at our webpage, which we'll talk about a little later on. But basically, we're coming at it in about 3 phases, and where we are right now is in the first phase, and that's dealing with the overall orientation and recruitment. You know, I've learned over the last 2 months, it's really very difficult to recruit African American men to deal with this thing. And as you say, basically with prostate, it's hard for them to come together and talk about it. But our director down at in Columbia said, Barnette, don't worry. And he said, that's why you get the project, so that you can try to figure out what's causing or why African American men choose not to do the early screening that could help them maybe not get involved in a more serious nature of the cancer. So basically, the project is scheduled to run over to recruit 100 African American men. Even if you're not the basic goal is to look at 100. And we're going to do this, as I said, through the 3 phases. One is the orientation phase. And then after the orientation phase, we're going to look at bringing educational material, some opportunity to some healthcare professionals like going to be on tonight. After that, we want to make sure what included in that is they will engage in what we call an anxiety. So we want to figure out basically what is causing us not to get involved. And I said that to you about many years ago when I was in Montgomery, Alabama. At a particular church there, we had a deacon in our church, and he kept telling us at our men's group, guys, you need to get yourself checked. We didn't know that he was already probably in stage 3 or stage 4 prostate cancer at the time. But we know this cancer, it's easy, or Dr. McGuire will give you more about it. I am not a medical person, so he can tell you more about the whole idea. But the bottom line for us, the fraternity project, is to make men more aware and become involved with the early testing. And what we have put up on our website, so you can go directly at your own leisure and go through the orientation process, and learn more about this. And then the final thing is that we want for all of them, this is what we're going to be tested on, evaluated on, that at least get 80% of that 100 to get tested during this 12 months. And then after that, we want to have a big party. We hope that it is the way sometime in July, maybe August, that we can bring everyone that's participated together in a big party. We have several incentives in there, and the big one at the end is that you'll have an opportunity to win at least a 55-inch flat screen TV to get involved. But that's not the important thing. The thing is to try to save lives. So I'm going to stop right now and let some of the others come in if they need to at this particular point.
Okay, could you just before I'm going to get to Doc to give us some background and from his primary physician perspective. But could you give me that website again?
Yes. The website is, try to keep it easy, it's the NEP Cancer Grant.com. Again, that's NEP Cancer Grant.com. And it has all our information on there.
Okay. NEP.
And let me say, the full project, what we're doing now is navigating from the traditional. So everything, all 3 phases that I told up on that. We get to, we're just focusing on the phase 1. But when we do the phase 2 and phase 3, that will all be online. So you can sit at the house and go through the whole process. The only thing we can't do is when you have to do the actual physical or go see a healthcare professional. That's when you got to go see Dr. McGuire and some of the other people. And all you just need to let us know is that you've done it.
And we've got it. That's why we got it. Right here. So you can go to see the doc. Okay. Okay. Thank you
Go
so
see
much.
it. That's what it's all about. Go see the doctor. Go see.
Well, thank you much, Mr. Elazer. And before we go to anything else, we want to have the Dr. McIver could give us a some background as to why. And from what I've seen, a lot of people think that you can, not a lot, but some people think that you can just skip the primary doctor and go to a urologist when they hear that, but that's not the case, and we've got the doctor here to attest to that. And so, Dr. McIver, could you give us give us an overview of why it's supposed to start with the primary first, before we start talking about a urologist? Okay.
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 So, first of all, I'd like to thank you all for having me on. Thank the gentlemen of Omega Psi Phi for what they're doing for the community, to talk about this very important and very needed topic. Before I get into that, I'm gonna just kind of give a thumbnail of this, because the prostate is a very, very in-depth organ. It's a very peculiar organ, and it is it's very important organ, of course. So what is the prostate gland? Just kind of talk about it. People talk about prostate, but not even really know anything about the prostate gland. Well, the prostate gland is a male reproductive organ. It's located between the pelvis. It's located in the pelvis and under the bladder and in front of the rectum. So it's kind of down low in the pelvic area. Basically, the urethra that carries urine out of the bladder into the penis runs right through the urethra. And that's why you have some of those urinary symptoms with prostate enlargement or prostate cancer. What does the prostate gland do? The prostate gland adds fluid to the semen, which helps the sperm move to where it's supposed to go during ejaculation. So in other words, without the prostate gland, it's hard for a woman to get pregnant, because the fluid that you need to help that sperm get to where from point A to point B needs prostate fluid to go there. One other thing too, the women don't have prostate glands. Only men have prostate glands, okay? I heard a woman talking about her prostate was enlarged before. And I'm like, no, you don't have a prostate, sweetie. Only men have prostate, okay? Does the prostate gland grow? Yes, it does. The prostate gland is typically about the size of a walnut. But at the age of 40, it usually goes from about the size of a walnut to an apricot. And around 60, 65, it usually goes from the size of an apricot to a lemon. Now, depending on whether it's an even enlargement, whether one lobe grows larger than the other, could be whether or not you have symptoms or not. Those symptoms usually go along with what we call BPH, benign prostatic hyperplasia, BPH. Now, issues with the prostate. There are three main issues that can go on with the prostate. Number one, something called prostatitis, which is inflammation or infection of the prostate. A lot of times that comes from bacterial infections. Some of the symptoms are chills, fever, rectal pain. You treat that with antibiotics and anti-inflammatories. The next thing, the most common thing, is called BPH, enlargement of the prostate. 80% of men will develop some degree of enlarged prostate or BPH in their lifetime. By the time you're 85 years old, 90% of people will have some degree of BPH. And what happens is that about 3 out of 10, or about 30% of people, will have symptoms bother them enough to need prostate enlargement medicines. And the third thing that can happen with the prostate that we're talking about today primarily is prostate cancer. Now, there's been a lot of controversy and talk about when this PSA should be checked. A lot of different governing bodies in medicine that have different recommendations on when PSA should be checked. If you're an average risk with really no family history of prostate cancer, everybody should have it starting at the age of 50. However, African-American men and men with a first-degree relative of prostate cancer, that's father, brother, or son, should get prostate cancer PSAs checked at 45. And if you've got 2 first-degree relatives with a history of prostate cancer, you probably should start getting your PSAs checked at 40. So let me say that again. Average risk should be starting at 50. If you're an African-American male or have a first-degree relative with prostate cancer, that's at 45. If you have more than one first-degree relative with prostate cancer, you probably should start getting checked at 40. Okay? Now, getting it checked under the age of 45 might get denied by the insurances. I still try to check it anyway, and I still try to tell the patients that that may be the best investment that you made for that year, even if the insurance doesn't pay for it. So kind of talking about that specifically about the generalities of the prostate gland. Now, specifically about prostate cancer, there's approximately 30,000 new cases of prostate cancer in African-American men a year, 30,000. That accounts for about 30% of all cancers in African-American males. So 30,000 a year accounts for 30% of all cancers in African-American males. It's estimated that about 1 in 7 African-American males will be diagnosed with prostate cancer, as opposed to about 1 in 8 white males. Now, increasing evidence shows that obesity and tobacco use increase the risk of the more aggressive types of prostate cancer. Sometimes in prostate cancer, there are no symptoms early on. So that's why the PSA is so important, because sometimes a person may not have any symptoms at all. Later stages of prostate cancer include hematuria, which is pee in blood, inability to urinate due to the obstruction caused by the cancer. Bone pain is a late symptom. Prostate cancer often goes to the bone. The first case of prostate cancer I ever diagnosed was a person that came in having unexplained bone pain. No medicine I gave him would take care of that pain. We did a PSA on him, which he had been refusing to get for a long time, by the way. We did a PSA on him, and well, actually, before we did the PSA, I did an X-ray on him, because he didn't want to get one done. So I did an X-ray on him, and it came back looking like metastatic cancer. It has a particular look on an X-ray when prostate goes to the bone. I begged and pleaded with him to let's get a PSA. The PSA should be less than 4. His was 80.
80?
80. So that told me not only did he have prostate cancer, but it had gotten outside of the prostate cancer and gone to the bone. So that's a common route of spread of prostate cancer to the bone. As far as deaths related to prostate cancer, it's the second leading cause of death in African-American men after lung cancer. About 5,500 deaths per year from prostate cancer. African-American males make up the highest percentage of prostate cancer deaths out of any ethnic or racial group, about 2.5 times higher than white males. An interesting thing started happening, though, around 1993, the rates of prostate cancer death started dropping off. But around 2012-13, they've been leveling off. Still high, but not quite as high as it was in the 70s, 80s, and very early 90s. Now, the thought in that is because, the treatments had gotten better, surgical, radiation, chemo, use of hormones to help treat prostate cancer, and early detection was the thought of that drop down. But the counts are still higher than they should be, and it's still disproportionate among African-American males. Now, just a little bit more before I'm kind of quiet and kind of talk about answering questions. There's the overall 5-year survival rate of prostate cancer is about 96% in African-American males and 98% in white males. That's overall. But once the prostate cancer has metastasized and gone outside of the prostate capsule to other organs, the 5-year survival rate is about 30% for African-American males and white males. So the key there is early detection. The key there is making sure that you're getting your PSAs checked. The early thing is making sure that if it is cancer, you find this cancer with a early enough detection that it hasn't really gone far or outside the prostate capsule. Prostate cancer tends to kind of be really in two phases. One, if you get prostate cancer below 65, it tends to be more aggressive. And you're likely to die from it if you don't handle it. If you get prostate cancer in your 70s or 80s, you're likely to die from something else. It tends to be a slower growing cancer. And that's a generality, but that's a true statement. Okay. In terms of that, earlier detection is better. As far as treatment, we got what's called watchful waiting, which simply means you're just watching that prostate cancer because the person is not really a candidate for surgery, radiation, chemo, or hormones. Next would be medical, chemo or radiation. Next would be surgical, whether it's a radical prostatectomy, where they go in and just remove the whole prostate, whether they put radioactive pellets inside the prostate around the area that's cancerous, or whether they do it laparoscopic or robotically to remove the prostate. And next would be medications. There are hormones that can be given in people that are not surgical candidates for whatever reason, where you try to manipulate the male hormone called androgen, which basically androgen acts like gas on the fire. So if you can reduce the androgen level by hormone manipulation, it causes the cancer cells to grow slower. And those are for people who are not surgical candidates. Okay. And that's kind of prostate gland cancer abbreviated and scaled down to help folks understand what it is.
Well, that absolutely gives us something to as a lead-in for our further discussion with the gentleman or the organization with the Omegas who are going to deal with the fear, like you mentioned earlier, Doc, the fear of getting screening or whatever, you know, and this person that doesn't want to know what his PSA was, I mean, that's kind of frightening. I mean, you know, found it hard to believe, but yeah.
Well, I think he knew something was already going on, because after I pressed him harder about it, oh yeah, Doc, I've had some episodes where I peed blood, but I thought it was because I was drinking a lot of soda and tea. So as you start talking and they come up, he came out with more and more questions, but he didn't want anything done. But by the time it was diagnosed, there wasn't much that could be done.
Okay. Thanks so much for that intro, Doc. So let me ask one of you gentlemen of the Omegas and the NEP project. How can you address some of the issues that Doc came up with, and what in general, I guess, what your project is really about a little more, and what is pre-screening? I think everybody knows what screening is, but when you say pre-screening, kind of give us some headway on that. Well, you know, one of the screeners, one of the screening coordinators, either Dr. Elazer or Judge Aaron or
Mr. McQueen.
Yeah.
What I was getting ready to say in just a minute ago, thank you, Dr. McIvers, for the information that you've given. That's very important. And that's what we want to try to do with the African-American man or any minority, is to let them know the screening process of knowing more about your body,
Right,
about yourself, particularly concerning these cancers. And we do that through this program. We try to get them together and provide the educational aspects, as Dr. McIver has given us, towards this. This is very important to know about it. You know, for example, I'll be glad to tell you, in talking with some of my relatives and my family, I noticed that, and talking to others, that almost all my first cousins and my father and another individual died of prostate cancer. So it's that running, and my family makes me real concerned about knowing more about myself and the physical well-being of myself.
Absolutely. Thanks, Brother Aaron. We have a gentleman from Charleston, Brother Lee Moultrie. He is a candidate. Well, he's not a candidate, but he's under active surveillance now. So and later on in the program, we hope to kind of have him on there. Okay, and to kind of give us his overview of how he's been dealing with it. A lot of us, I guess, are under active surveillance. You know, once you find out if the PSA starts rising, to me that's active surveillance. I mean, then you got to go get a what do you call it? Biopsy, I guess. Yeah. So, Dr. Elazer, give us some of the methods that take place during your pre-screening.
Okay. Thank you for calling me. I've been trying to jump on and hit my mic muted earlier. But I wanted to follow up really what Dr. McGyver said about getting checked. And what I want to do right now is the ladies, son, brothers, husband, and this is what our project is about. We want you to come in early because we already know that African-American men normally choose not to go to see their doctors. In many cases, they don't go until it's too late. So what we're saying and trying to method in the what I have put up already, orientation is called the anxiety. It's early on in the, but what I'm saying is that a lot of men are saying that that's one of their fears is they go in and they hear this word about the PSA, or they've heard that is the only way, or some have not even heard that you can do the PSA. They've heard only there's the digital. And it's this male thing about, I don't want this other male doing this digital thing on me. And so they'll choose not to go to see a doctor until it gets too late. So the project is to make them aware, they need to know about it, just like Dr. McGyver has already talked to us about it. But also now, how do you deal with the screening? There are ways you need to go in and see a physician. Like if it's Dr. McGyver, he's going to recommend someone for you to go see so they can check you out and see what the situation is. And now, Mr. McQueen, another thing we're finding out too is that there's the insurance issue. Some are saying that they don't have insurance. If they don't have insurance, they don't go see the doctor and so forth. So that's what we're trying to, the educational part that Judge was talking about a little bit is, we want to bring in phase where we start talking about the educational material and start aligning them up with healthcare professionals. We're talking about project tonight, but again, you got men who they've heard about it, and a nephew that's up here in the Little River area, and I talked about it, but his mother, my sister, need to go get checked. He's already 47, I believe 46, 47 years old. And you heard what Dr. McGyver has already said about it. We need to get them checked early on. And so that's what our project is focusing on. But to be honest with everyone that's listening to me, it's still that fear. Even the fear just going to the website and just going through, it takes you about 15 minutes at the most to go through our first phase. Find out about it. And it doesn't cost you anything. All you do is go ahead. And that's why we have the big NEP. And I failed to mention this. It really means no excuses, but we want to offer promises. That's why to shorten up the whole grant project is talking about promises. If you go and get checked earlier, as the doctor, I see my urologist at least once a year, sometimes twice a year, just to watch and make sure that I'm not going over or under, and they can get on top of it. Because when I went to see him the very first time, he said, "Mr. Barnette, I'm going to tell you one thing. We have not lost one male that's been to us early." And so that's what we want the people to hear. And a lot of times, I know we're talking about men, but ladies, you know, sometimes you got to get on and tell us to get on to that doctor and let them help us with what they can do and so forth. So that's kind of where we are. Method-wise, you were saying is that still we want to get them in. Once we can get them in, we can start directing them to some of the healthcare and so forth. And as I said, the end goal is to actually have them be tested on one or all of the three cancers that we're looking at. So I'll yield a little bit and let someone else that might want to have something to say about that, or I'm open for questions.
Ms. McQueen, that is one of the most important things why we have this program going, is to help educate them concerning the conditions. And again, I know he may have mentioned earlier, but this is all funded by the South Carolina Cancer Alliance. they are concerned also about the ways of Black men and not taking care of their bodies and seeking help and making sure they have the right screening for certain cancers at a certain time.
Okay. You know, I don't know how many of you are aware of one prominent person who just got his prostate removed, and he had that choice. And I want to kind of highlight it for you. His name is Al Roker, and I picked this off of the day's program just to let our audience see what this guy had to go through. It's a short clip, so if you just bear with me, I'll have it for you. Okay.
We're back 8:13. It's been a little more than a week since Al announced his diagnosis of prostate cancer. And last week, he underwent surgery.
We have an update. And guess who's going to give it to us? The man himself. Al, first of all,
morning.
Your smiling face makes us feel so good. How you doing?
Oh, I'm doing great. The better for seeing you two, let me tell you, and to be with you, it really is special. And walking around, the number of people who've just given me a thumbs up and said, way to go, and hope you're doing well, has meant all the world to me. And I just went to the doctor yesterday. And
let me try it again.
We're back 8:13. It's been a little more than a week since Al announced his diagnosis of prostate cancer. And last week, he underwent surgery.
We have an update. And guess who's going to give it to us? The man himself. Al, first of all,
morning.
Your smiling face makes...
Obviously, yeah, must be some difficulty there, but we've been having this throughout the program, obviously. But anyway, if it's corrected, I'll get back to us again. But that was Al Roker, and he was given his synopsis on why, especially Black men, should do it early. And they gave one of the statistics. I think Doc may have mentioned it about the fact that we're 1.5 times likely to die from it. But Doc highlighted some of the reasons why. Okay.
2.5. 2.5 times.
2.5. And Doc, I don't think you can say that strong enough for anybody, especially Black people. But you know, let's go back to this issue of insurance. Black people are just beginning to really get a lot of insurance themselves. I remember when my mom was living, one of the issues she had with the hospital at that time, she couldn't pay the bill, so she just refused to go to the hospital herself. I mean, even when she got ill, from the last bill. Okay, so I don't know if those issues still persist today or not, but certainly we must take those things under consideration. And the other thing is that we as a community have got to find a way to make sure that we have affordable health care that's available for just about everybody. Okay,
yeah, right.
One way or the other. I don't know what we can do legislatively or politically or what, but we got to make that a high priority. We just have to do that. And that's why I put so much. I salute you brothers from Omegas with the NEP project. I think that should be dear to a lot of citizens in Conway. Black and white, okay, and everybody. Really, you were about to say something.
Yeah,
but so even though you mentioned like the insurance, even we still have people that may have it, but choose still to go to the doctor. That's another part of our program we want to work or integrate in it is how do we get them and still to motivate it, even if you have some have it and there's still something about some of us that will fit. I can wait. And I'm just going by personal, like my son's worked for Blue Cross for about 20 years, and with the COVID, he, they had to cut back and he lost his position. And so, I was talking with him about moving forward, but they told me, I guess it's about a month ago, he said, well, Dad, this is the last day of my insurance. And I said, now you work with Blue Cross, but you're at the end. But My point, what I got angry with him about is he waits to the last day when he needs to sign up for whatever he needed to do in the next phase. So now he's got to wait all the way to January to try to get involved where he can get from the affordable care. Now that's my own son. And they wait and they do these things, and then they want to come. Well, say, I don't have care. So those that are listening, please don't let that hold you back. If you don't have insurance, try to find out another way. And that's one thing we're talking with the South Carolina Cancer Line. Well, what do we do when we find a men who say for whatever reason they've exhausted all means that, and the only that's holding them back is the insurance issue.
Right. And let me say this too. Unlike a lot of other tests, you should be able to get a PSA done for under $100. Okay. So it is something I think here in my office, I think we do it for under 60. So if you don't have insurance. So again, we're not talking about an expensive test. Okay. I want to say that and make that clear kind of right off the bat. That's one of those things, like I said, like I tell patients who don't have insurance, that's one of the best investments you'll make for that year.
Absolutely.
Okay. We're talking about something that's under $100 in most cases for a PSA to be done.
In your case, it's under $60 in your office. Is that what you said?
I think we got fee schedules for everything, but we do it for under $60. And I'm not promoting for me by saying that. What the point I'm making is that this is not a costly test.
Wow.
So like Brother Barnette said, a lot of times this is just people just either not taking the time to get it done for whatever reason, but and they may not know it's not a costly test, those people that don't have insurance. But that's why I want to emphasize that point. Right. This is not a costly test. This is not like a $2,000 colonoscopy or $1,200 colonoscopy. It's not that kind of cost. Now, if you have cancer, or if you got to get further follow-up and evaluation, that's where the cost can come in. But just to get the screening, we're not talking about a very costly test.
Perhaps Dr. Elazer and Brother Aaron and Mr. Randall, perhaps you could have that part of your project. That is to get the word out that the test itself is not that costly, and Dr. McIver is just saying it's under $60. I think when they hear that and they see what the consequences are of not of being, active observing your prostate, that might resonate quite well. So what do you think? Could that be part of your program?
That is a part of our educational program itself, Brother McQueen. And that's why it's so important that we have these sessions. And we also want to thank Dr. McIver. He's volunteered to speak a lot concerning this during our sessions, along with some other doctors. But that's one of the things that we hope to be able to get through to everybody doing it. If we don't have the funds, maybe we can arrange something with some hospitals. There's still some hospitals and places that will do this test for you for free. There are some doctors who will come in and do this test for you without charge. So Dr. McIver is right. It's very little cost in having that done. And when we continue with the program, we hope to be able to educate people and strengthen them in lines to getting this done.
And as we're reaching out to those healthcare professionals, the other doctors, urologists, in terms of some of the other cancers that we're dealing with this grant, the oncologists, we're asking them for some educational information to perhaps to put together a video, a short presentation regarding whatever cancer that may be, but also asking them how can they help us with the screenings. And what I found is the doctors, the healthcare professionals in the area are interested in the health of the community. And we went to, and we are, this grant is primarily for African American men because of the disparities that we face. And so we're trying to, really trying to focus in on African American men. We aren't exclusively African American men, but we're really pressing in on them. And we're pressing in on prostate cancer, colorectal cancer, and lung cancer. Those things are killing the Black men. And one way you can do something with that is by the screenings. And we're trying to address why aren't you being screened? Part of it is education, part of it is insurance, part of it is fear, and we're trying to address those things so that we can get you to where you need to be. But again, we are, we're trying to get the men, make the men aware. We're trying to make the men aware through the women in some cases, but we're trying to make the men aware. But we're also trying to really try to engage the help and support of the local healthcare professionals. And we're expecting, they are responsive. They have been responsive, but as we're getting closer to the next phase in a few months, we hopefully we'll be able to. If you don't have insurance and such, that we'll be able to provide some assistance that way as well.
This is such a critical issue. But we have to go to a commercial, okay? Your brothers, just hang in there with me. Got a lot more to say on this issue, okay?
Having problems with your vehicle? For quick, prompt, and courteous service, call Snag and Drag Towing. Gregory Graham will make sure that you're taken care of right away. 843-997-0751. That's Snag and Drag Towing Service at 843-997-0751.
Add this to it. Where we talk about.
If you're looking for flowers for any occasion, the Daisy Fair Flowers is here to help you. They offer an enormous selection of flowers, gift baskets, and live plants for delivery in Conway, South Carolina. Serving Conway since 1980, the Daisy Fair Flowers, 1400 4th Avenue in Conway, or call 843-248-7222. You may also visit the web at thedaisyfairflowers.com. Looking for a full-service funeral home with a broad array of services? Look no further than McKeever Funeral Home at 1408 Race Path Avenue in Conway, South Carolina. They offer a wide variety of services, including traditional funerals, memorial services, and graveside ceremonies. You can reach them anytime, day or night, at 843-248-2706. That's 843-248-2706. McKeever Funeral Home in Conway, South Carolina. George L. Williams Jr. is CEO and licensed funeral director. Support the party that supports you. Vote for your own interests and those of your community. The choice is clear. Horry County Democratic Party. Take a stand. Register to vote 2020. This advertisement is paid for by the Horry County Democratic Party.
Because it's been greater than usual. We don't have that, but we'll get better at it. Okay, but I think part of the live streaming itself. So anyway, we left off with the issue of I believe we talked about insurance and difficulty of people of lower income getting insurance. Can someone turn this speaker off? Okay. Yeah, we were talking about the insurance bit. I saw if you go to I saw the website, and it looks like it's very well laid out and interesting things that you all are projecting to do. Now, exactly when does the project begin, and has it been interrupted because of the COVID? Can someone elaborate on that?
Okay, I had to unmute myself. The project started in July. It is active right now. You right after we finish the show, and you go right to our virtual registration when you go to our webpage and actually go through the orientation process. Now, included in that orientation are several short, about 30-second video clips for each of the respective cancers that we're talking about. And when you finish that, you get down to the survey, which we ask us about 8 questions on the anxiety survey. And then there's a little survey as to how did you enjoy the experience fixing. But that's open right now, phase 1, and that should be open until about February the 6th. Our goal is to have 100 people in phase 1 by February the 6th. And then after that, we'll start opening probably March, April with phase 2, what you had been, where we talk about the insurance features, fees, and things like that to the physicians. And as Judge Butler was saying, we know Dr. McGivern is one that said they'll help out. We got other physicians, professionals that want to help, but that'll start in phase 2. And what will happen then, and Mr. McQueen, we'll let you know and keep you in the loop, because we want to hit it again hard when we start on the phase 2. And then the phase 3, we just want to make sure that they go see someone, and that's it. So, but it's open right now, 24/7.
But in answer to your question, yes, COVID has created issues for us, hurdles for us to overcome, and so we're overcoming them through virtually. We're making the information available. When we started the project, we were talking about doing a face-to-face and group meetings and those we were planning to utilize technology, but we almost at the point now we're almost exclusively going to technology up to this point. But it can be done. It needs to be done, and so we're committed to making the information available. We're committed to trying to meet the men so that they can get the screenings that's going to give them the information they need to live stronger, healthier lives. But COVID has caused us to make some adjustments, and it's mostly adjusting the time periods.
So Doc, do you have you have special emphasis on, I'm going to go back to prostate again, okay? Do you have any special emphasis on that in your office, or is just on a general practice? Because I'm aware that you're a primary physician and you probably go through all the illnesses, but how much emphasis is there placed on prostate in terms of getting the word out?
It's a lot, and it's important. The majority of the patients that I have, male patients that I have, I do the PSAs here in the office. There's some men who have already had established relationships with urologists, and I encourage them to keep that relationship going. But the majority of people that come through the office, that come through most primary care offices, do not have a urologist. So that's why it's incumbent on primary care physicians to be actively involved in screening for prostate, talking about lung and colon cancer. I want to say this to keep it in perspective. As far as the new cases go in African-American males, new cases of cancer is prostate, lung, and then colon. Prostate, lung, and colon as far as the incidence of cancers. New cases, prostate, lung, and colon. As far as deaths, is lung, prostate, and colon. So there's a difference in new cases and differences in incidence of death in the order in which they come. And all three of them are important, and I'm glad to hear that their grant is focusing on all three, but new cases is prostate, lung, and colon. Deaths are lung, prostate, and colon. So it's just the prostate and lung that flip.
I see these commercials about, of course, they're selling pharmaceuticals to make you live longer if you have a certain level of lung cancer. Can you elaborate on that a little bit? I don't understand what they mean, Doc.
Well, there are different types of lung cancer. And so depending on which kind of lung cancer you have would determine your 5-year survival rate. In terms of cancer in medicine, we talk about survivability typically in terms of 5-year survival rates. The mathematicians, the people that kind of follow biostatistics, follow this stuff and follow this data for us to be able to give this to patients. It also is important because that's a lot of times a determination in how to treat. Whenever a person has a cancer, it's two things that have to be known. Number one is called the grade of the cancer. Is it aggressive cancer or is it a non-aggressive type cancer? That's the grade. The stage is, has that cancer been confined to that organ or has it moved beyond that organ? That's called the stage. So when you put staging and grading together, that's what gives you not only the 5-year survival rate, but it also gives you what the best treatment options that you have.
Okay.
That's very important, not just to know you got cancer, but know the grade and the stage of that cancer. Has it gone outside of the organ? Has it gotten into the lymph nodes? Has it gone to the bone? Has it gone to the brain? Has it gone to, the colon, to the liver? Those are important. That's why the CAT scans get involved. The MRIs get involved once the diagnosis is made to help the physician get the grade and the stage to understand the severity of it and how to treat it.
Okay, so Dr. Elazer and any of you who want to address this issue, what kind of funding? You didn't mention any monetary value of the funding, but are you at liberty to give the amount of the grant that you all received?
Yes, I can. We were awarded a $10,000 grant for a 12-month period, and as the director said, not going to physically 1 through 12 because of COVID. So we got in July. We finish it until October of next year. But he said as long as we stay with our objectives, we're okay with going through and following up with the grant. So yes, and we do plan, as once this is done, to try to ask for additional funding. As a matter of fact, I guess 2 months ago, I have a meeting with the director every, matter of fact, I had one today, once a month. And the question, he said, do you guys need any? Well, I said, yeah, but I'm trying to figure out, how can we manage what we have? Because as brother Coleman Randall was saying, is that when we put the budget together, we were kind of looking at from the traditional format where we had to maybe rent a facility to get a group together and have food and all those type of things, but changed all of that for us. And so we had to reformat and actually use, as he's already said, the technology as our primary direction, other than where we could get groups together and so forth. So that's where we are now until, we're glad to hear about the vaccine going into arms today. And hopefully for COVID and so forth, they hope, hopefully summer or fall, we get that behind us and get a degree of normalcy. But yeah, that's the bottom line we're looking at. But I wanted to say this before I forget. Going back to that anxiety survey is important for me because another thing, and this going back to Dr. McGuire was saying, one of the questions is why they don't go is the fear that they might get a result saying that they have cancer, and it's a fear. They look at that as being a death sentence for them. So a lot of them are marking that high. That's a high anxiety thing for us. So another reason why a lot of men choosing to go, because they're afraid that if I go in, I'm going to find out that I have cancer. And as Dr. McGuire was saying, they don't know what grade, what stage of it. They just figure out when they hear that big C word, it's all over for men. So that's another thing we have to, on our educational program, it's not all over all the time. So unless you wait too long. Okay.
Right.
Yeah. I think we needed to hear that. We really need to hear that. And I only heard one person talk about the method that everybody is fearful of, and that is the part where we're doing your regular physical. Your doctor has to use his finger to find out how big and feel how big your prostate is. That. Mm-hmm. Once somebody hears about it, that's a lot of hesitancy there for them to move forward and getting that kind of examination. But even though it's a good examination, the doctor you can clarify things if you like. That is just when you feel for the prostate, you're just feeling for the size, right? So if it's
not just the size,
not just the size. Okay.
You're feeling for the smoothness of the prostate too.
Okay.
So after doing, I don't know, gosh, I've been doing prostate exams now for darn near 28 years. So basically, you're feeling not just for the size of the prostate, but you're also feeling for the level of smoothness. Okay. And it's hard to really explain that to you, but just after decades of doing this, I know what's normal and what's not normal. Okay. So the kind of simplify it, the prostate gland is almost kind of like you look at the top of a heart, right? How it kind of goes and dips in. That's how the prostate gland is. So when you do the prostate gland, you're doing what's called a prostate sweep. So you're going from one lobe to the middle, and it should come down, and it should be just as smooth and even going above and over the other side.
Okay.
If you feel any irregularities, like you're not going up as it's taking longer for you to go up or higher than one side to the other, then you know there's some degree of prostate in that individual side, whether it be right or left. So it's not just the size, it's also the smoothness, the contour, what we call it, the contour of the prostate gland. That's important as well. Again, like I said, as men get older, our prostate will enlarge. From the decades of doing this, I can tell if this is a normal size prostate for somebody in their 60s versus a normal size prostate of somebody in their 40s. That just comes from doing it. But again, it's multiple things, but the prostate gland primarily will tell you the rectal exam of the size of it. And that doesn't really tell you about cancer. So that's why it's important for both things to be done, the rectal exam and the PSA. Because you can have a normal size PSA, but you can still have prostate cancer because it's on a localized level and a focal level.
Wow, but that's really important.
Yes.
Do we have time for one?
Go ahead.
One, the two fears, I think Ms. McQueen, did you? Okay. Started off with saying fear that we get is the rare, and the other part is the biopsy. Now, with my urologist found out, he asked me about 3 years ago, I had insurance that could help me, and Dr. McGyver maybe there's an MRI type thing. At the time I took it, it was only I had to go down to Thailand months ago. That one can help detect have cancer than the biopsy. So, Dr. McGyver, what is the name of that? Do you know that MRI's name? Because that's another one that's new. It's
just basically a high resolution. It's a high resolution of the prostate. And basically, they've got different names for it depending on the machine that's used. But basically, it's just a focused indirect. They got different ones now. They've got one actually where you can actually use a probe and have that on the inside, but it's basically called a high resolution MRI. And that basically is what a lot of places are starting to use now to be able to help look at localized prostate cancer. Some people call it high resolution, some people call it 3D. It just depends, but basically it's just a focused MRI looking at the prostate gland is basically what it is. And so it kind of focuses on that. One thing I do want to mention though, to make sure as a part of this education, because whenever I talk about it, I always want to talk about education. 42% of all cancers and 45% of all cancer deaths, and this is all cancers now, all cause cancer. 42% of cancer cases and 45% of cancer deaths are caused by modifiable risk factors. Modifiable risk factors. In other words, things that you can control, such as cigarette smoke, such as e-smoking, such as having good body weight, increased physical activity, proper diet, ideal body weight. reduced in alcohol intake. All those things are what we call non-modifiable risk factors. And then have the diet, controlling your diabetes. You know, those things have a significant role in reduction of cancer cases and cancer deaths, upwards of right under 50%. So those are what we call modifiable risk factors. There are other things that are called non-modifiable that we can't control. We can't control our family history, our family genetics. So those are non-modifiable risk factors. And those people that have those, as I said earlier, first-degree relatives, they need to definitely be on guard. But there are modifiable risk factors that are just as important, that if you work on those things, you can significantly reduce the cases, and in a lot of cases, the deaths related to all cancers, not just prostate, but all cancers.
Well said, Doc. Well said. I mean, I do a lot of literary research, and those are some of the things that stick out. Just about every report I read or every document I read from places like Johns Hopkins University and Kettle Memorial Cancer Center, they have good information about that. And you know, from a non-doctoral perspective, to me it makes sense. Okay, it made a lot of sense, and that's why we're going to continue to put these kind of things in our magazine to let our readers know about it. You know, so and just let me, while I'm talking about it, let me salute this group, the Omegas, Horry County, on this endeavor. And I would like to find out what precipitated you guys to really make this effort for this type of study, or this type of cancer screening, I might add. Dr. Elazer, you want to address that? What initiated this project?
Okay. Well, I'm going to let Brother Butler handle that one.
As part of our own social action endeavorment from our fraternity is to be able to provide things that are very important within the community, not only to like males, but other folks also. So one of the things that we're really interested in doing is talking more about males, black males, and the conditions of cancer within black males. So that's one of our social action programs that we try to do.
Okay. Okay.
Let me go ahead and jump in too. Brother's been a little modest too, because his wife is one more project to our attention. Told us that there was a grant. Can you guys write? He retired, and they told me. So, but yeah,
she is a very, very, very vigilant person about cancer herself, and she's very knowledgeable. I think she does a lot of research on the different cancers and stuff like that. So kudos to her. We're talking about none other than Miss Deborah Butler. She was on our program some time ago to talk about one of the things with breast cancer, but it's another issue. It's cancer, but another issue. So, but anyway, look, time is. Go ahead, Dr. Elazer. You wanted to say something?
Yeah, I was going to say, I thought I heard one earlier. Yes, about one thing, we want to make sure we continue the program, and I'm very appreciative of you having us on tonight, but we might need to do a one-on-one, because we're ways that we'll be able to help you as long as you can continue to provide kind of advertising we need to get this message out to the community continuously. So that's something we might want to do a sidebar on. Well,
the Whittemore Community Magazine is always want to be of assistance to the community. Okay, because it's a community magazine. That's the name of it. And something as
Right.
important as the project that you all are endeavoring upon. I think we're all for it. You know, and if you need any kind of collaboration, please don't hesitate. Okay, we'll be there, and we'll help get this work. Okay,
that's good.
Yeah, I want to thank everybody for really participating in this thing. This is a critical issue, especially for Black men. And we're not. I want to put emphasis on it. And I was told by I think it was I read it that in the website it said it's not just for Black men, but it's for men. I saw that part, but we have to. I thought I read that on the website, but this men in general have this issue, okay? But we as Black men, we have it more abundantly, and the organization, the Omegas, are endeavoring to do something about it. So again, I salute you guys on that. And you know, Doc, you have any last words, Doc, you want to say?
Well, I'd like to thank you for having me on. I talked to several members of Omega, and I told them I'd be more than happy to assist them in this endeavor. I think that it's very needed. It is something that is near and dear to me, just in community involvement in general.
Right.
Cancer is something that is very important, and it's affecting African Americans at a far higher rate, primarily because of later detection. Now, there is some genetics in that too, again, and that's debatable on to what level and what degree. But we can say without a doubt, when I like to talk about modifiable versus non-modifiable, the issue is that we're just getting detected later. And once that, specifically talking about prostate or colon, lung also, but definitely prostate, colon. Once that cancer leaves that organ, you're now playing catch up. You're now playing catch up. You have a much higher chance of successful treatment, successful curing, if it's caught early enough. If it's not caught early, you're playing catch up. And so now the importance is education, early detection, prevention, education for long life.
Well, okay. Look, brothers, look, again, I salute all of you. And I want to ask the question, how many of you attended your last Mardi Gras, the Omega's Mardi Gras, which back in 2016? I'm asking because if you like, I can show you some photos. We can go off with a good photo. If we don't have any technical difficulties, okay? If you don't have any
right? I want to say one other thing too before you answer that. It is true that Kappas and Omegas can work together. Okay, I want to say that. That's important to know now. I mean, we have much more in common than just being founded in 1911. So we can work together, and I made sure that my Omega brothers who called me and asked me to be a part of this, I told them it was in 1911 love. So Kappas and Omegas do work together.
Look, that's a voice
again too, brother McQueen, about allowing us to be on your program, and congratulations again on winning the Citizens of the Year award from Omega Psi Phi fraternity.
Oh
for the community and for your program and others. Thank you.
Well, I certainly appreciate that, Brother Aaron, and I was awarded that award. I'm holding it dear to my heart. Okay, I was being not because I was in engineering, but I didn't have the opportunity to pledge any of the fraternities. I might would have considered Omegas. I might.
Wait, that's not what you told me. That's not what you told me, Brother McQueen.
Might be time to go.
That's not what you told me.
All right, brother.
He just hadn't gotten to. He might have considered Kappa.
Yeah, that's right. I might have considered, and that's honest. In all honesty, I'll tell you, I was in a to me it was difficult trying to get off engineering. I mean, I'm talking about fishing, so you know that was enough for me. But anyway, we're gonna go off with this, and good to our audience. See everybody next week, and we're gonna go off with some photos. I try to pick the nice ones that show everybody the light. I didn't see any of you brothers except Brother Aaron on there, but we're going to try to do this more often because I've taken a lot of photos of not just the Omegas, but the Kappas, Doc, and AKAs and stuff like that. So we're going to let the community know the good efforts that all these fraternities is doing. But Doc, I got to reemphasize that what you said about unity, man, that's what's needed among the joining of all these fraternities. Okay, we got to start doing some economics here. Okay, there's potential, you know. Okay, but here goes. I'm gonna mute everybody, but there's no music behind it.
Thank you for watching the Whittemore Community Magazine live on Facebook. You can watch a rebroadcast of this episode by visiting WCM Live on YouTube.